Hello, my name is Amy Pendleton Kay, and I'm a registered dietitian and also the owner of Edge Nutrition and Dietetics private practice in Greenville, South Carolina. Today, I just want to provide you with some quick information on something that's actually pretty common, but we don't talk about it a lot. And it's called Polycystic Ovary Syndrome, otherwise known as PCOS. And this is actually something that a lot of women, a lot of individuals who are um, born with ovaries will experience in their lives. It's actually pretty common, and it is something that can be difficult for the patient to manage if they don't really understand what is going on with their bodies. And so that's why I really wanted to talk about this today and just let you know that if you do have PCOS, that there are lots of things that you can do, lots of positive things that you can do to help improve your symptoms and just to help you feel better. So I want to first start by explaining what is PCOS. Well, it is a medical condition that affects how your ovaries work. So, if you have PCOS, you might have irregular periods, you might even have absent periods. You're also likely to have an increased level of those androgen hormones, and those are what we think of as typical male hormones, such as testosterone. And you're very likely to have numerous follicles around your ovaries. So, what are some of the symptoms of PCOS? Well, there are quite a few. They can include acne, insulin resistance, poor sleep and fatigue. You might notice weight gain or difficulty just keeping the weight off, extreme food cravings. You might experience some difficulties in getting pregnant, those fertility problems. You might have excess hair growth. And of course, as we mentioned earlier, irregular periods. Now, the good thing is, like I mentioned before, there are some things that you can do to help improve your outcomes, to help reduce some of those symptoms. And it really starts with lifestyle based intervention, specifically nutrition intervention, and of course, also physical activity. So, there are things that you can do that you can change in your life, some behavior change that will help improve your quality of life and get things back on track for you. It's important to note that if you do have PCOS, you are at an increased risk of developing type 2 diabetes. And clearly, this is something that we want to avoid. So, these lifestyle based nutrition interventions that I'm talking about will also help curb your risk for developing type 2 diabetes. So, today I just want to give you a few quick tips that you can start implementing now to help improve your symptoms and start on that journey towards feeling better. So, the first one is I want you to eat regular, balanced meals and snacks throughout the day. So, if you are somebody who maybe just eats one or two meals a day, you're skipping a lot of meals, or you're trying to save up for dinner time, what I want you to do is really try to eat regular meals and snacks. And that might be just three smaller meals and a couple of snacks in there each day. That helps balance our blood sugars throughout the day. It also helps us avoid getting so hungry and maybe eating beyond our fullness levels at the dinner time and evening time. So regular meal times and regular snacks are going to be really important. Number two, I want you to focus on eating mindfully. And this is something that takes a little bit of practice, but once you learn to eat mindfully, I think you'll find that you really enjoy mindful eating. And that is just a process of sitting down, removing distractions, putting your phone away, and focusing on your meal. You need to give yourself enough time to actually sit there and enjoy your meal and a real key is to eat slowly. When you eat slowly, when you eat mindfully, you are less likely to overeat. You're less likely to eat beyond that fullness mark. And that's because it gives your brain time to actually receive the signal that you are full. It's not quite automatic because if we're eating very, very quickly, sometimes we eat beyond the point where we're full. We're like, ugh, I feel miserable. That's because we've eaten so quickly that it did not allow our brain time to get that signal. So eat mindfully, eat slowly. Um, Also, we want you to incorporate some enjoyable physical activity, not something that you're going to hate doing and dread doing every week. Not saying go to the gym 7 days a week. I'm talking about just something that you enjoy, like gardening, like walking, something that you will do several times a week, and that you can look forward to, and that you can enjoy, and that's something that you can add to your weekly routine and turn it into a healthy habit. Next, I want you to incorporate plant-based foods into your diet. Those are going to be lots of fruits and vegetables, whole grains. That's going to give you a good source of fiber, which is going to be very filling. It's great for your digestive system. It's also great for your blood sugar levels. So plant-based foods are going to be key, and they're also anti-inflammatory, and that's important. Next, I want you to reduce those sugary beverages and snacks. And the reason is it's not that sugar is going to cause diabetes. I'm not saying that at all. But sugary beverages are often empty calories, meaning they don't provide us with any additional nutritional value. They're just strictly providing us with calories. And a lot of times that is a significant source, an unnecessary source of excess calories that don't otherwise benefit our body. So reduce those sugary beverages, those sodas, and those types of things. And that will actually benefit you a lot. And next, I want you to consider consulting a registered dietitian. And of course, I am a registered dietitian, and so I speak from an expert level about this. I can tell you that working with a registered dietitian can be life changing because we help you create a custom nutrition prescription that meets your needs, that meets your lifestyle. I sit down, I listen to what your days are like, to what your challenges are, and together we come up with a plan so that you can achieve your health goals, so that you can reduce your symptoms, so that you can feel better, so that you can manage the PCOS. And I provide the support and education that you need. And trust me, it is life changing. And working with a dietitian after just a few sessions can make just such a tremendous difference in your overall health. So, thank you for joining me today. I hope you learned a little bit about PCOS, and I hope you also leave knowing that there are things that you can do to positively manage PCOS and the PCOS symptoms. If you have additional questions, please reach out. Again, my name is Amy Pendleton Kay. I'm a registered dietitian. I'm the owner of Edge Nutrition and Dietetics in Greenville, South Carolina, and you can visit me at my website. That is www.edgedietetics.com, or you can even give me a call if you live here in the Greenville area or the South Carolina area. That is 864-200-2066. And thank you for joining me today.